Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today I have an email from Victoria who says, my brother is on a ventilator in intensive care and he was breathing on his own for 5 hours and then became tachypnic. Should I consider putting him on a ventilator or CPAP support? Thank you. There's a little bit of contradicting information there from Victoria. Again, I'll read this out again. She says, my brother is on a ventilator and was breathing on his own 5 hours and then became tachypnic. Should I consider putting him on a ventilator or CPAP support? Thank you. Tachypnea means breathing very fast. Now, if your brother is on a ventilator, is he on a ventilator with a breathing tube or is he on a ventilator with a tracheostomy? That's the first distinguishing factor here. Let's assume, I'll go through both scenarios so you can understand what both scenarios look like. If your brother is on a ventilator with a breathing tube and he was breathing on his own for 5 hours, then became tachypnic, well, he stays on the ventilator because you're saying he's on the ventilator already, right? And should they CPAP him? Well, he is probably on CPAP already if he's breathing on his own and he's on a breathing tube, right? When someone is on a breathing tube and people are talking about they're breathing on their own, they're talking about him breathing on CPAP or pressure support. So if he's tachypnic, breathing fast on the pressure support, put him back in a controlled mode like SIMV or ACV, assist controlled ventilation, and ventilate him until he can have another go at CPAP or pressure support. If he can't manage that and it goes on for over 2 weeks, right, God forbid, then he will need a tracheostomy because he won't be ready for extubation, right? And should you then, and let's just run through the scenario where he has a tracheostomy in a situation like that. So he's on a ventilator and he was breathing on his own for 5 hours. Again, if he was breathing on CPAP and then he became tachypnic, should I consider putting him on the ventilator? Well, he's already on the ventilator or CPAP support, right? So the only difference with a trach is if he's on a trach and he's breathing on his own, he might actually be breathing spontaneously and they might have put him on a trach mask or trach collar. Now, if he has 5 hours on a trach collar, for example, and he's breathing independently, completely off the ventilator, should you consider putting him back on the ventilator with CPAP or pressure support or with an SIMV rate or an ACV rate where the ventilator is doing most of the breathing? Well, most of the time you can try CPAP first, CPAP or pressure support, right? And that might be enough to give him a rest, let him sleep overnight or whatever the case may be, and then try again in the morning, right? So that is one way to handle it. Now, if he really is so exhausted after breathing spontaneously and he needs to be fully ventilated, you know, on SIMV or ACV where the ventilator is doing most of the work, then maybe in the morning you can try CPAP again. It's when weaning someone off the ventilator is often trial and error. And, you know, you got to go through the motions sometimes until you achieve your goal. Now, another question here is, regardless of whether your brother is on a ventilator with a breathing tube or with a trach, is he getting physical therapy? Is he getting mobilized? What are they doing to aid him getting off that ventilator, right? So those are questions that you need to look for. Also, on top of what I just explained, what are his arterial blood gases like, right? That is also a very good indicator on what needs to happen next. So for example, he's getting exhausted and on the CPAP and his blood gases are really poor. Well, put him back in an SIMV or an ACV mode where the ventilator is doing most of the breathing for your brother, right? His blood gases should improve. And then same thing, you can try again tomorrow, right? And the blood gas will also give you an indication if he can have time off the ventilator again, if he can be extubated, if he has a breathing tube, right? Also, how often does he need suctioning, right? How frequently does he need suctioning through the breathing tube or the tracheostomy tube, right? What does the chest X-ray look like? You know, does he have any chest issues besides being ventilated? So those are things that you should be looking for here, Victoria. I have worked in critical care for nearly 25 years in 3 different countries, and I have seen many of those situations, whether with a breathing tube or with a tracheostomy. And I've worked as a nurse manager for over 5 years in intensive care. We've been consulting and advocating for families in intensive care all over the world here at intensivecarehotline.com, and you can look up our testimonials at intensivecarehotline.com by going to our testimonial section. And I can confidently say we have saved many lives with our consulting and advocacy by giving families a second opinion, by giving families a voice. And you can also verify that on our podcast section, where we've done some client interviews. Also, that's why we created a membership for families of critically ill patients in intensive care. And you can also become a member at our membership at intensivecarehotline.com by clicking on the membership link, or by going to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I personally have written and recorded, sharing all my experience in intensive care, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment. Also, I offer and do one-on-one consulting and advocacy over the phone, Skype, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly, hand-holding you through this process in critical care, making sure you don't get this once-in-a-lifetime situation that you can't afford to get wrong, making sure you get it right, and making sure you make informed decisions, have peace of mind, control, power, and influence. I also talk to doctors and nurses directly with you and on your behalf, and I ask all the questions you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. And call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have. Share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on the show. And you will get notification for the YouTube live if you sign up for my YouTube channel, or if you sign up for our email newsletter at intensivecarehotline.com. You can also make a small donation or a big donation at the super chat button here on YouTube. That helps us create more content, helping as many families in intensive care all over the world. And also, if you want your question answered quickly just via video and you make a small donation, I will read that out pretty quickly. I have questions as far back as November, December last year. So I'm not keeping up with videos, even though I'm trying to do one every day. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.